Hi again, Facebook viewers. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. I think it goes without saying that many of us are feeling pretty stressed and worn out right now, right? Some folks are also feeling isolated and lonely. For today's discussion, we're going to be talking about how to cope with the anxiety we're feeling and why it's important that we not let our guard down leading into the upcoming holidays and into the winter. I'm pleased to introduce our esteemed panel of experts from Henry Ford and HAP. We have with us Dr. Catherine Frank is the Chair of Psychiatry and Behavioral Health at Henry Ford. Welcome, Dr. Frank.
Thank you.
Dr. Adalis Abreu Lafranco is an infectious disease physician at Henry Ford Hospital.
Hello, everyone.
And Dr. Peter Watson, Vice President of Care Management, Quality and Outcomes at HAP. Dr. Watson, welcome.
Hi, good afternoon, everybody.
For our Facebook viewers, make sure to read our disclaimer at the top of this thread. And we're going to jump right into it. And Dr. Frank, I'd like to begin with you, please. With the patients that you and your colleagues are seeing in behavioral health, what types of mental health concerns are patients most struggling with?
So patients are really, and families are struggling with a host of things right now. I think first and foremost is grief. And that's for a number of reasons. Grief related to loved ones and friends that they've lost due to the epidemic. Grief related to losses of job, isolation, and so forth. There's a study done that said that for every person that you lose in this epidemic, probably 9 Americans experience a grief reaction. If you do the math, that means literally close to 2 million people in the United States may be suffering from grief reactions. Grief and depression are kissing cousins. And so the depression, it's estimated, may have increased 4 times. Anxiety about what's going to happen. Am I going to be safe? How am I going to survive financially? Is a very big piece of what's happening. Some people estimate that thoughts of suicide may have doubled in the United States as people are grappling with medical, social, and other things. And lastly, substance abuse is on the rise, largely because people are feeling what else is there to do, trying to self-medicate how they feel. So depression, anxiety, sense of hopelessness, symptoms that interfere with sleep, with appetite, with energy, and trying to make sense of the fact that the world has become so different in the last year. And that hopefully, as we'll talk about later, there's some hope down the line with the vaccine. But with winter coming on and the holidays coming, I think people are feeling very concerned and stressed.
And since the pandemic began, Dr. Frank, what's been the trend line that you've been seeing relative to patient appointments? Is it your sense that more patients are seeking help?
Yes, without question. I would say that our referrals are up a couple hundred every week. And I know that that's true of my colleagues across the country. There was an estimate of a study done in June of this year that suggested about 40% of Americans in June were struggling with mental health issues. So, it's on a timeline for people that are feeling stressed and fed up and tired of the isolation and the changes in their life and the lack of freedom to do things that they used to do to feel better, to people that had some psychiatric issues that are now compounded by all the medical, environmental, social, financial things happening.
Does this come close to anything you've seen in your career, Dr. Frank, just in terms of the overwhelming sense of what's happened from a behavioral health standpoint?
Certainly not. This is unprecedented. In looking at other cultures and countries that have gone through this, so the SARS in Hong Kong a few years ago, they found very similar trends with what people dealt with. And sadly, I'm not saying this to scare people, but to be aware of your health, people predict that the mental health epidemic will follow the COVID epidemic, that going through recovery, putting your family, your job, your finances back together. So the good news is there's help for that, but that many people feel that the next 2 years, if we look at SARS and other epidemics, may be a more difficult time than usual.
Dr. Watson, what about on the HAP side? Are more members asking about insurance coverage for mental health care these days?
Yeah, certainly we are seeing a similar pattern as Dr. Frank described for Health Alliance Plan. Of course, we have a large shared membership with Henry Ford Health System, but of course we have a number of other mental health providers in our network, and we are seeing a pretty significant climb in mental health visits, requests for mental health resources, more hits on our websites that are offering information about mental health. So in a number of different domains, we're definitely tracking a much greater seeking out of resources and help for these issues. So we are really trying to partner to bring whatever we can to our membership to help them through this.
One of the silver linings that we've seen during the pandemic is the explosion of telehealth visits and video visits. Dr. Watson, what do you make of this? And are we seeing patients across all age demographics in for telehealth visits?
Yeah, yes, we are seeing in the spring and early spring and late spring, when we had our first peak in Michigan, we saw a tremendous rise in overall telehealth use, which actually included use of mental health from a telehealth basis. We did see a little bit of a tapering off in the summer as the weather got warmer and caseloads went down a bit in Michigan, although we still were at a higher rate of use than prior to the COVID epidemic. We do expect to see another uptick in telehealth use now that cases are starting to climb again in Michigan and hospitalizations are climbing. I do think that the rate of increase of telehealth is actually another opportunity to open up more access to telehealth, particularly for behavioral health, because it allows more people to access mental health resources without necessarily having to go into the office, particularly for those who might need some levels of support that can be offered through telehealth sources.
Dr. Frank, what's been the feedback you've been receiving in terms of patients using telehealth for behavioral health services?
It's generally been extremely positive, David. I mean, the only problem that most people see is when the technology fails or freezes. It can be frustrating, just as we all at home when our web fails. I think, though, that people express the fact that this is keeping them safe right now. So from a public health and a personal safety point of view, telehealth makes total sense within psychiatry. It also, people generally see their mental health professionals more frequently than they may see their primary care doctor. So they're not getting a babysitter, they're not having to drive. I can't remember the number in my head, but it's hundreds of thousands that has been saved just in gasoline from going to your doctor. It's accessible. When you see a mental health professional prior to this, you're often saying, well, I have to leave work, so I have to figure in the drive time. Now people can close their office door, go in their car, in the parking lot. It takes away also the stigma that unfortunately exists regarding mental health care. So for a lot of people, and both clinicians and patients and families, it's a win-win.
One final question on the telehealth topic. Is the appeal here to stay, do you think, after the pandemic goes away? Dr. Frank, your thoughts, and then Dr. Watson, please.
Certainly, we know that Medicare, which is often the parent who decides on the other insurance that sets the policy, is at least approving this through mid-January. I do hope that insurers look at it as a tool. We know that when people get mental health care who need it, it tends to lower other health care costs. It keeps people well. It keeps them from getting sick. So the more we can do that and make it accessible to people, the better for the patient, the better for the family, and the better for healthcare in general.
Dr. Watson?
Yeah, I totally agree with Dr. Frank. I think that at HAP, as a health plan, we are fully committed to the importance of mental health as part of the holistic support of our membership. And anything that we can do to promote and expand access to mental health and physical health resources, we want to do that. Dr. Frank was correct in pointing out that Medicare has given us guidance through around January 20th to the 21st to continue offering this, and we are very eager and supportive of a continued expansion of that benefit, and are eager to see continued guidance from Medicare and other agencies to promote that use. I also think the state of Michigan has been promoting more telehealth use for the Medicaid population. Again, we are very supportive of that as well. So we are doing all that we can to promote continued access and support of our providers in the network to promote access to these vital resources.
Dr. Abreu-Lafranco, how are you?
Hello, how are you, David?
Turning our attention to COVID more specifically, with the number of cases rising again, what concerns you most about where we're headed?
So I think I wanted to first acknowledge the magnitude of coronavirus in our country. As of this morning, we have more than 10 million people in the United States that have been infected with the coronavirus, and at least 240,000 that have died. Weekly infections that are reported reach a record levels in half of the country in early November. So as we initially thought, the initial curve that we saw in the spring, and then kind of later on smoldering or slowing during the summer, what we're getting to see maybe in the remainder of the fall as well as winter might be a higher degree of infections. The reason for this is because coronavirus spreads really easily from person to person, and mainly due to close contact, especially if you are closer within 6 feet, through respiratory droplets that are produced in many, many ways, including if you cough, if you sneeze, if you talk, if you yell, if you're singing. And respiratory droplets cause infection mostly because they get through your mucosa, meaning your mouth, your nose. And the interesting thing about this is that some other illnesses, you get to have symptoms before you can transmit the infection, but coronavirus is special, or in particular, can be infectious prior to developing symptoms. There's other two ways that you also need to think about why this is so transmissible, is that in certain circumstances, it can be airborne, and also through contact and surfaces. My plea, I guess, I'm going to start with this first, is that if you use any face covering, it's one of the easiest and simplest tools that you can use to decrease the spread of the virus, especially if you are not sure if you're in that window where you don't have any infections.
But speaking of the mask wearing, the social distancing, the hand washing, these are all preventive measures that we know are effective. But as we've been seeing across the country, there's a lot of fatigue around that, Dr. Abreu-Lafranco.
Yep.
So any suggestions on how we can address that?
Yeah, this is the hardest thing, because this is like we have a race, but we don't have a goal in end. We're just racing, and we don't know where we're going to get to the end point that will be to control the spread of the virus. So I know it's really easy at times to just let our guard down, but I think keeping in mind simple things, like I have my hand sanitizer with me at all times, and I always try to think of, well, did I touch anything? It's such a simple thing, and I'm just gonna demonstrate. I'm just using the hand sanitizer as I talk to you. I'm gonna be doing this for 20 seconds, so nobody actually forgets about this. But wearing a mask, I think a mask is the most important thing. I have not so fancy mask that I'm gonna show you. I have my Halloween themed mask that I've been wearing for the last few days. I like Dali, so I actually got my mask that actually has a Dali picture, but you can make it fashionable in a way that is making it part of your personality, and it's something that you get to make it part of your day-to-day activity. So the important thing is you can have your own mask and make sure that they are double filtered, so inside and outside. That's something important. And then just remember this. an ounce of prevention, it's more important than a pound of treatment. And I think keeping in mind that maybe you don't want to do this for yourself, but you're doing this for your loved ones. And just keeping in mind that your safety is the safety of the people surrounding you.
One of the things that that everybody's looking at now is the vaccine. We know there are many vaccine candidates in the pipeline. What's a reasonable expectation, Dr. Abreu-Lafranco, for when one might be available for the public?
Absolutely. This is actually one of the, I will say, some of the silver lining news that we have. It's very encouraging to know that one of the 11 vaccines that we have in the latest stage trials, it is actually, we're showing a lot of hope that it actually will be able to prevent infection. So efficacy in vaccines is quite interesting. So a vaccine that can prevent infections in about 40 to 60% of the cases is considered a winner. So in particular, the most recent one that we're getting an efficacy of about 90%, that's really, really promising. There is just the beginning of the steps. I am actually looking forward to see the safety analysis. Again, the priority for any of the scientists that is producing these vaccines is something safe. So we're looking at is effective, but we want to make sure that the next step is going to be safe. The following steps had to do with applying to the FDA. And that could happen in not sure the timeline for that. And then the next step is going to be to look through the CDC who might be the priorities for immunization at that time. So it is very encouraging to know that the vaccine is in the horizon, but we need to look a little more into safety data as well as the steps to make sure that and ensuring that this is a safe process that we're going to have available for everybody.
And Dr. Watson, when a vaccine does become available, will there be any kind of out-of-pocket expense for people receiving it? That's the first part of my question. The second part would be, just for the general public, what types of information should they be looking for in a vaccine to ease their concerns about whether or not, they're going to make that decision to get it?
Well, I think Dr. Lanfranco actually covered some of the most important parts of vaccine and approval and safety and efficacy. And so from a health plan standpoint, we take our cues from the federal agency. We cover a host of vaccines right now already for common conditions, flu being one of them, as well as a host of other preventive vaccinations. A COVID vaccine that is met the FDA standards for safety and efficacy is certainly something that we as a health plan, and I would expect our other health plan colleagues to do the same, would be covered. We will be taking some guidance, of course, from the federal government on this, but I would expect that we would cover this, and of course that we would cover something of this magnitude with minimal to no out-of-pocket expense. There will be some issues related to distribution and other matters to get that vaccine to individuals. And I see that health plans like HAP will be playing a role with that. We are, of course, a very important part of Henry Ford Health System, and we're already partnering with the system right now in understanding how a potential vaccine would be deployed and distributed in the health system and to our members. So we are trying to take a very early part in that as a plan. And certainly as we get more vaccine candidates that are approved, we're going to want to support wide distribution of that vaccine to our members.
Dr. Abreu-Lafranco, with more people heading indoors now as the weather turns cold, there's widespread concern, obviously, that the coronavirus spreads more easily indoors, right? Why is that?
I think I tried to make a case of the reason is because close contact, less than 6 feet, this is something that can be, it's airborne in a way sometimes. The new part of the CDC recommendation that in the past it used to be that you needed to be in a continuous contact with someone for 15 minutes. And right now it's a new way that we are looking at cumulative. So if in a given day you had contact with somebody without wearing a mask or having all those steps, the distance 6 feet, not wearing a mask, and the timing that it will be 15 minutes, that will be a higher risk. I think what it's trying to enforce is the need for wearing masks. in this circumstances. The other thing that is very important is ventilation. So ventilation is really important because it kind of dissipates some of the virus through droplets, as well as the airborne mechanism. When we are indoors, especially if we have no windows open, especially during the winter, so that makes it also a little higher risk to get transmission. And then when we are close to each other, it's kind of human nature to touch each other. We might be touching surfaces as well, and not doing hand sanitation in between those activities. So that's a reason why we have a higher risk of spreading this viral infection when we are indoors.
And Dr. Abreu-Franco, for those who may be traveling during the holidays, what are your recommendations for reducing your risk of infection and staying safe?
Right. I can tell you this: the holiday season is going to be very different this time around, and I want you to think about it this way. If by any chance there's any one of your relatives that might get sick, or either you get ill, is that something that you think that you might want to consider being kind of part of that transmission? If you're thinking about traveling, what you need to think is be smart when you're traveling. If you can do some of the traveling by on the road, would be great. If you're actually thinking about flying, always keep in mind your surrounding, especially pack your hand sanitizer, wear a mask, look to see your surrounding. Maybe you need to wipe the surfaces next to where you are. One important thing also to keep in mind is there might be some restrictions depending on where you're thinking about going. Every state has a different rate of infection from every state, and it might be that you need to have a test before you actually travel. Those are just few of the things that you have to keep in mind. I might suggest a few other things to maybe consider. That this year might be a very different time for you to, or a special time to think about using our fantastic technology to maybe take advantage of that to still celebrate some of the holidays. A few of the things that you can think of is you can still replicate part of the magic of getting together with your family through any either Zoom meeting, any Google Meet, or any of those platforms. And you can set a time to say, now we're going to actually have dinner at this particular time. It might be that you want to exchange recipes, or if your family lives close by, you can have a small gathering outdoors as long as nobody gets hypothermia, low temperatures, or you can maybe cook and bring some of those meals to your family members. So then it's kind of in a safe way. If you prefer to have a gathering at your home, I think it's important for everybody to be careful. If anyone is sick or at any time is sick, that they shouldn't be coming to your gathering. Try to make it that is as individualized as possible. Maybe plastic utensils as well as plates. Maybe you can prepare that everything is already all set up in a specific area, and making sure that everybody keeps in mind the 3 steps. Wearing a mask, if you have anybody that doesn't live with you, hand sanitizing, try to keep your windows open if you can, or preferably do some of this gathering outdoors.
What's the rule of thumb when it comes to gatherings at home? Is there a number that people ought to be thinking about that's sort of minimum for families?
I don't think we can actually say, so the distance will be, is your room big enough to host enough people that they can be 6 feet apart? So that will be kind of the rule. So it's hard to say if you have a space that is this many square footage, you can actually have this many individuals. I think the best thing to think is try to maybe have that celebration in a more intimate way, and then maybe think about, I know it's hard, and this is one of the reasons why we're having this conversation right now about the stress and kind of the holidays, but always thinking about what will be the unintended risks by maybe having this celebration. What will happen if, with all the good intentions, we actually get sick, or we get sick, the group of individuals that we care the most, grandma, that is all, that they have medical conditions. So it might be that decision that, is that me showing love in person might be at times more detrimental than me trying to do it in another way and trying to care for each other by maybe being apart, at least for the time that we're able to protect each other.
Dr. Watson, what would be your thoughts on things like Black Friday shopping or some, attending outdoor winter events, for the next few months. We know that the America's Thanksgiving Parade is not allowing people to come down and watch. So what recommendations can you offer?
Again, I think I want to build on what we just talked about, and that is thinking about our upcoming holidays and traditions in a different way. Again, honoring those holidays, which I know are so very important in our families, certainly in my family, and thinking about how can you do those things differently. Again, using virtual technology, particularly when families are separated by distance so that they're not flying. And for families that are more local, thinking about changing those events or having them in a different way where you can really allow separation. It requires a lot of planning. And then for those other outside of the home events, parades and things like that, obviously those things aren't going to be occurring the way they have in prior years. Hopefully we will get back to those in the next year or so. But in the interim, thinking about still getting outside if you can, separating, masking, distancing, and hand hygiene remain important even in outdoor events, and really being mindful. We have to, unfortunately, have to interact like everyone that you're interacting with, symptoms or none, is potentially infected with COVID. So it's really approaching any event in that way with that mindset. So that means limiting events, but if you feel that an event needs to happen, doing it on a smaller scale, using technology, spreading out, doing it in different ways.
Dr. Frank, we know this time of year can be difficult for a lot of folks, right? Earlier you talked about people who have lost loved ones, some have lost their jobs. Can you talk about some of the strategies that would help people cope with the feelings they're having?
Yeah, I read a quote not that long ago that said, "This is not the year to get everything you want. This is a year to appreciate everything you have." And I think that's a different mindset. And I believe that changing how we think about these losses and what this year has meant to all of us is going to be important in surviving. To think about what you have in terms of the people in your life, what you can do remotely to still get joy. So instead of a regular telephone, a FaceTime, a Zoom meeting, how you can create new types of fun traditions for you and your family, how you can focus on the fact that despite the pain of this year, there is so much hope now. There will be a recovery. There's no doubt about that. And I think that it's important for us to be thinking about that recovery and not just being angry at the things that we may not be able to do. But there's still far more things we can do than what we can't do.
The risk of suicide. What types of things can family or friends do to help, Dr. Frank?
I think in part just sharing. I mean, reminding us of what we have, reminding us that that there is an end in sight to this, that we have so much more than what we don't have, and to look at those, paying attention to our sleep patterns, making sure we're eating, making sure we're finding ways to connect socially in a different way than maybe we've done in the past. To echo what was said, one of the things that's difficult, I think, about this virus is we often maybe in the past said, oh, that person looks sick, I'm going to stay away from them. But with COVID, somebody could be asymptomatic and spread the disease. So we have to think not only of our own safety, but those of the people around us.
Dr. Watson, what kinds of resources does HAP offer for those who will have a difficult time coping?
So one of the roles that we played at HAP is to try to be an information vehicle. We're on a regular basis updating our hap.org website with information, often leveraging some of our expertise from Henry Ford Health System to provide clinical information, and also to help route people to our members to information that might be helpful to them. And that's not just our members. Our website is open to the general public. Secondly, we've tried to work with our own staff teams at HAP to take inbound calls and navigate our members to resources that can help them. Again, Dr. Frank's team in behavioral health for Henry Ford has been a tremendous resource for us, for our members, to support them through this time. And then I think finally, we're trying to look for ways as a health plan to look very creatively at our benefits and learn from this COVID epidemic to think about how we as a health plan can use premium dollars to support our membership, to complement the great clinical work that's been going on by our clinical teams in the network, including Henry Ford and others. So looking at things like food support for those who have food instability after a hospitalization, caretaker support for those folks who might need it. We're challenging ourselves to look for new and broader benefits to support people through this time.
So we're coming up on our end of our segment today. So before we close out our discussion, I'd like to ask each of you to share a take-home message for our audience. Dr. Abreu-Franco, I'd like you to go first, then Dr. Watson, and then Dr. Frank, please.
So just keep in mind that there's a lot of things that you have control over in terms of what you can do to stay safe and keep your loved ones safe during this season. Just become a little more creative and maybe kind of to find some resources to still celebrate during the seasons, keeping in mind safety as well as showing that you care at times by doing these things. There is hope in the horizon that things will get better. We have more understanding about the virus. We have more, we're advancing in the way how we can treat, but also how can we prevent this with vaccines in the horizon. And take care of each other and take care of yourself.
Dr. Watson?
Yeah, I think as we enter into the winter months and again, an inevitable sort of spike in cases here in Michigan, I want to reiterate to people who are listening today to please have trust in our institutions, in our health systems, in our organizations that are working around the clock. We have learned a lot in these last 6 to 7 months of dealing with COVID from the first spike in the spring. Great minds at Henry Ford and other health systems who are really very prepared for this next wave. So please trust our health systems that they are doing all that they can to help you out. And we know that there are things that are out of your control, but please know that there are so many people at the health plan, at the system level, that are thinking what they can do to really help you through this time.
And Dr. Frank?
No, I agree with what's been said. I mean, what we know about this illness is so different now than in March when it hit us. And we actually know how to prevent people from getting the spread of this illness. And that really falls on each of us to work together to protect ourselves and to protect the people around us. It is very important that we have hope. There will be recovery. We are going through an unprecedented time in the United States history. And the vast majority of people have been heroic. And we all have that hero in us. And so it's important as the winter months go and Michigan, and we're waiting for the vaccine that will hopefully make a difference in all of our lives, to hold on to that hope and to hold on to us working together, because there's no doubt that we can defeat this virus and that life will get very good again. This is going to be a grieving, mending, and then a full recovery.
Great comments by you all. Doctors, thank you very much for an insightful discussion today. We also want to thank our audience for tuning in and watching. For more information about today's discussion, you can visit henryford.com/coronavirus, as well as hap.org/COVID-19 coronavirus. Also, the number to the National Suicide Prevention Hotline is 800-273-8255. Thanks, everybody, for participating. Stay safe and remember to mask up, and we'll see you next time. Bye now.
Thank you.
Thank you.
Bye-bye.
Bye.